I want to thank all of you for joining this call. This is a time of great challenge in our country and great anxiety for individuals and families and small businesses and large businesses. And we are all engaged in trying to meet this challenge and follow the guidelines that have been set, which will, if followed, reduce the dangers that we have and the spread of this terrible virus that afflicts not only us, but the global community. Tonight, I wanted to give you the opportunity to ask questions, and I have some experts with me from Maryland and from the federal government who are going to be handling much of the request of how do I get money, what can my small business do to get a loan, and other questions of very great importance in the short term and long term, for I know so many of you on this phone call. So let me get right to it. First of all, we have Dr. Josh Sharfstein, who's with the Johns Hopkins Bloomberg School of Public Health, a graduate of Harvard Medical School and a former staffer of Henry Waxman, one of the health experts that served in the Congress and served as chairman of the Energy and Commerce Committee, which has so much jurisdiction over these issues. Then we have Michael Harrison. He's the policy director of the Maryland Department of Labor, Licensing, and Regulation. They'll be involved, obviously, in much of what goes on as a result. And he also received his master's in public policy from Johns Hopkins University. Then we have Andrew Fulginiti, who is a graduate of Towson University and is the policy officer at the Maryland Department of Labor and Licensing and Regulation. I think the two folks, Michael and Andrew, will be able to answer some of the questions you have, practical questions about how do I get this, that, or the other. Then we have Antonio Doss, who's the district director for the Small Business Administration's Washington Metropolitan Area District Office. The Small Business Administration has been handed an extraordinary challenge to get money to small businesses, to employers, employees, to keep small businesses afloat, and to make sure that they're available so that when the economy does rebound, when we can go back to work, whether that's May or June, or whenever that date is, that is safe for us to get back and engaged, that those businesses will be up and running and ready to go. And then Stephen Umberger, who is the district director for the Small Business Administration Baltimore District Office. So we have two folks from the Small Business Administration. I'm sure we'll have questions for them. And so I welcome all of them. Thank them very much for being with us. And let me just say a few remarks. Again, Governor Hogan, I think, has done an excellent job of getting our state in the best position it could be. He issued a stay-at-home order on Monday for all of Maryland, and I've been staying home just like I'm sure so many of you on this phone. This is a new push to fight and stop the spread of the coronavirus to ensure public health and safety. To the extent that we do not come in contact with one another, we can't pass the virus to any other person. And that's what is going to lower that curve that you've all been watching on the president's briefings and on the news programs. I urge everyone to heed that order and stay home. Unless you are going to purchase or pick up food, going to the pharmacy, traveling to an approved essential job, or seeking medical care. We are in this fight together, and everyone shares the responsibility of stopping the spread of coronavirus and protecting the most vulnerable in our communities, our seniors. But when you look at the incidence of positive tests, you see that the 30 to 49-year-old crowd is got some of the highest numbers. Last week, as you know, Congress passed major bipartisan legislation. And on the 27th of March, in fact, essentially we passed both in the Senate and the House unanimously the third phase of our response to the coronavirus challenge, not only from the health standpoint, but from the economic standpoint. This follows earlier legislation to support research. My other phone rang. Apologize for that. get back to what I was saying. The legislation that we passed on the 27th of March was preceded by two pieces of legislation, which I call 1 and 2. And it also dealt, first of all, with the immediate medical needs, and the testing and vaccine research, therapeutic research, to try to meet the immediate need. The second bill dealt with the economic needs as well and the medical needs. And the third bill, which was the most far-reaching, is trying to give a lot of money, a lot of our money, but money necessary to stop the scourge not only of the health crisis, but also of the economic crisis. The newest measure, the CARES Act, which was signed into law on March 27th by President Trump, aims to help workers and businesses through this crisis. It includes, and this is very important, direct payments to Americans, $1,200 per adult and $500 per child. So if you're a family of four with a husband and wife, that's $2,400, and another $1,000. It could be as much as $3,400. Now, in addition, $600 extra each week for those on unemployment insurance. That's above and beyond what the state gives in an unemployment benefit. Billions in SBA loans, very important to small businesses that want to stay afloat and be there when we can get back to work. $100 billion for hospitals. Senator Schumer calls this a Marshall Plan for hospitals, but clearly they are under great stress, and this money is available to them to meet the needs of the patients and the community they're serving. And $17 billion for veterans care alone. It also includes funding to help ensure that the coronavirus pandemic does not disrupt our elections in November. As you may know, we already have an election in Baltimore on April 28th, and that election, the governor has directed, will be done through mail, so nobody has to go to a polling place to vote. The goal is to make sure that while we put major parts of our economy on hold to help workers stay home and stay safe, those who are furloughed or laid off can get back to work as soon as the crisis has passed. To that end, the House continues to stand ready to do whatever is necessary to help while this situation continues. Together, we have to do everything possible to, as I said, flatten the curve and protect the vulnerable. Only when public health experts tell us it is safe to do so can we begin to reopen our economy. Tonight, we're joined by the five guests who I just introduced to you, who can answer your detailed questions about how we are fighting the coronavirus and how the CARES Act can help people in Maryland's 5th District and the state of Maryland generally get by until our economy comes back fully. Again, Dr. Sharfstein, Mr. Harrison, Mr. Fulginiti, Mr. Doss, and Mr. Umberger are ready to answer your questions. So we'll go right to questions now.
Thank you, Congressman Hoyer. For those of you just joining us, if you'd like to ask Congressman Hoyer or any of our guests a question, please press *3 now. Our first question comes from Rochelle in Bowie. Rochelle, you're on with Congressman Hoyer.
Hi, thank you so much for taking my question. I am currently employed in a healthcare profession, and I work 4 different jobs, including 2 for the same employer that vary between W-2 and 1099 positions. I've been furloughed from all but one of these positions, so I've lost about 80% of my income. My question is, what am I entitled to under the state of Maryland and the CARES Act, and what is the process to obtain that assistance, and what, if any, documentation is required from my employers?
Okay, well, let me turn that over to the people at the SBA, because that will be one of the, you don't have a small business of your own, so your relief is going to come both through direct payments and enhanced unemployment insurance. And in fact, there's a provision that I think they'll talk about, which if your employer keeps you on, essentially, if they're a small business, they can get a loan, and that entire loan can be waived. That, in other words, they wouldn't have to pay it back if, in fact, they keep you on the payroll. But let me yield to either Mr. Doss or Mr. Umberger. which one of you wants to take that question?
Well, I'll
Okay,
start off and go ahead,
Okay,
Steve.
go ahead, Anthony. Go ahead.
Well, let me
Okay.
start. Yeah, we can't see each other. Sorry. This is Antonio Das. So the point that the Congressman is making is a critical one. What we're really trying to do with our loan program is incentivize the employers to keep people employed. And through this Paycheck program that we have that is literally rolling out right now, businesses can borrow money and actually get reimbursed for their payroll expense. So essentially, they almost will have no cost to keep you employed. And that's our goal, is to make sure everybody continues to stay employed, to continue to stay in their job, so that we don't lose any of the, the economics of this. And we're making these loans available. There's dollars that are available to help the businesses get exactly what they need to cover not only your payroll, but your benefits. So if you're out for health insurance and even sick leave and such like that, are all covered under this particular program. So that's one of the key features that we have right now that we're using to help small businesses and even nonprofits be able to keep people employed.
The program that he talked about in terms of trying to keep people employed is called the payroll protection provision, because what we think is the most advantageous is if a small business can keep their people employed. Now, you may not be going to work because of the stay-at-home order, but you would still be on the payroll. If you have health insurance through your work, presumably they would continue to pay for it out of the loan, and then they could have the loan forgiven if they kept their employees on a payroll. And that protection is for, I think, 4 months. Stop me if I'm wrong on that. It was 3 months in the Senate bill, and we expanded it by a month. So that would mean that they could keep you on the payroll for 4 months and at literally very little or no cost to themselves. Next question.
Again, if you'd like to ask Congressman Hoyer or any of our guests a question, please press *3 now. Our next question is from Yvette in Bowie. Yvette, you're on with Congressman Hoyer.
Hello, and I'd like to thank you, Senator Hoyer, for all of the work you've done, and all of the people who are working in to keep us all healthy and safe and fed. I'd like to find out, what is the criteria that will be used for us to come off of self-isolation?
Doctor, you want to speak to that, the criteria? And I want to ask Dr. Sharfstein to do that, because that is essentially, I think, going to be when the public health officials advise the governor and the president and all of us when it is safe and when we have, in effect, flattened that curve. But Dr. Sharfstein, you want to speak to that?
Sure. So I think part of the question might have been if somebody is personally isolating themselves. So isolation is when people are sick. So if you're sick, you shouldn't be going to work. You should be staying home, staying away from other people to the extent possible, putting something in front of your face, like a mask or a scarf, if you're near other people, and washing your hands quite a lot. Even if you don't know for sure you have coronavirus, that's very important. And the question was, for how long? And the answer to that is generally you have to get completely better and then add 3 days. And that whole period should be at least 7 days. So you really completely better plus 3 days before you leave isolation. Now, what if you've been exposed to someone who had the illness? So you didn't get it yourself, you're not sick, but you've been exposed and you're worried. Then that's called quarantine. And you really should be 14 days by yourself. 14 days, even if you don't feel bad, because during those 14 days, you could get sick. And it really doesn't even matter if you do a test then, because the test could be negative, but the virus could still be inside you waiting to come out. So you got to wait the whole 14 days. So if you're sick, it's till you get better plus 3 days. If you're not sick, but you are exposed, then it's really the whole 14 days. Now, the other question, Congressman Hoyer, that you mentioned is, well, what about the isolation that we're all experiencing and all of the restrictions, when do we get to end that? And boy, I wish I knew the specific day to tell everyone. But basically, what's going to happen is, if you think about what happened to us as we were living our life with, the lights on, and all of a sudden the lights went off and we had to stay in place. It's going to be more of a dimmer switch to turn it back on. First, we've got to make it through this process of all these people getting sick and making sure we have enough hospital beds. We can get through that process by everyone doing their part, doing their isolation and quarantine. Then we'll have a chance to build back up some capacity in the healthcare system, to strengthen our ability to respond to individual cases. Hopefully we'll have some treatment. And as that happens, we'll turn the dimmer switch and we'll start to get the ability to do more things over time. And we're hopeful that that process might even start, this spring. But it's going to depend really on how well we do at this moment, as we're facing such a big challenge right now with the increased number of cases.
Thank you, Doctor. Then I was speaking to the second part, obviously, that Dr. Sharfstein spoke to, and that is the fact that all of us are being isolated because this particular disease, this particular virus, is transmitted person to person, largely by waterborne or when you sneeze or you cough or something of that nature. And it is easily transmitted from people to people. That's why the 6 feet, stay 6 feet away from people, which is tough to do, but is necessary if we're going to flatten that curve and not have the virus continue to, in effect, be hosted by each of us because we're in close contact and we get it from the other person. But hopefully, as Dr. Sharfstein said, because of the real pain and certainly inconvenience and economic consequences of this isolation strategy, it is very uncomfortable. And hopefully we will get to a place where it will be safe to go out and about once again. Even then, even at that point in time, in that twilight area, we will need to be much more careful than we were and wash our hands, say hello to people, not necessarily shake their hand or give them a hug, so that we can, again, it's going to take all of us together to beat this thing. Okay, next question.
Thank you, Congressman Hoyer. Again, if you'd like to ask a question, please press *3 now. Our next question comes from Claude in Bowie. Claude, you're on with Congressman Hoyer.
Yeah, I wanted to get some information. If you've already been furloughed or have had your hours cut, what is the process to obtain the new benefits in the federal bill for scenarios like that? You still go through the Maryland office, or is there a separate process for the federal side for those benefits? Because right now it seems the Maryland office is pretty backed up with everything that's going on.
Well, I think in fairness, all the offices are backed up, including the IRS, which is going to be sending out the checks that I mentioned, which will be not the unemployment side, but everybody's going to be getting a check, some 170 million plus people, the others being children. And then we have to identify other people because everybody is going to be eligible for a check under a certain income. And the criteria is $75,000 and under, and then it's phased down from the $1,200 per adult to zero at $99,000, and you're not eligible if you are an individual making more than $99,000 or a couple making more than $198,000. So each adult can get that. Now, let me with that sort of preview, let me yield again to Antonio or Stephen to answer the specific question of how you're going to access that. Now, those dollars, by the way, that I mentioned, they will be sent out without your having to make an application for that, and the IRS is going to administer that. And in the first instance, 60 million people, about by about April 13th, to the extent they filed their tax returns in 2018 and or 2019 and have a direct deposit, they'll get $60 million. 60 million people will get dollars through that. But in terms of application for unemployment benefits, let me yield to Antonio and Stephen.
Congressman, I'm actually wondering if I could yield to Andrew or Michael on this one for the unemployment piece of this.
Okay.
Yeah, I'd be happy to. This is Michael Harrison, the Maryland Department of Labor. Thank you, Claude, for that question. And I think it kind of touches on something that Rochelle asked very first. So the CARES Act expands eligibility for unemployment to independent contractors, sole proprietors, people in the gig economy. So you will be eligible for state-provided benefits as well as the $600 a week payment from the federal government for a maximum of $1,030. The state benefits are on a scale based on your income. If you are partially employed or have had your hours and salary reduced, you are eligible for partial state benefits, but full federal benefits of the $600. $600 is good for 4 months. The state benefits is good for 26 weeks plus the federal government extended benefits for 13 weeks on top of the 26 weeks. So if your benefits have expired, you may reapply and you will get an additional 13 weeks. Now, I would urge you, everybody on the call, to search Maryland Department of Labor for our homepage, and there's a link for unemployment. And on that link, there's information on how independent contractors can apply. There's a text box. You can enter your email address to receive updates when the system is ready to take applications for the expanded coverage. There's frequently asked questions. There's also phone numbers and email addresses you can contact with follow-up questions. I'll leave it at that.
Michael, let me ask you a question if I can. I've had the watermen here in Southern Maryland talk to me, and of course a lot of them are independent, some may be sole, but independent operators, and of course the restaurants and bars are shut down, and that's 80% of their market. And they're going to be eligible under this bill, as I understand it, and that's what I think we made sure that they were eligible. Can you comment on that? Independent
yes.
Employers, sole proprietors?
Yeah, exactly. Those independent contractors, as watermen, those sole proprietors, they are eligible for both the state benefits under the federal legislation and the expanded $600 a week payments from the federal government. Now, we are waiting for guidance from the U.S. to start issuing payments. This is a federal program implemented by the states, and so we are waiting on the USDOL to tell us what information that we need to collect from independent contractors, how to verify wages, and some other information. We should have that in the next day or two. So
I think, Michael, I think that came down late this afternoon. The information I have, I'm not sure of that, but I think it came down late this afternoon, so you ought to have it by tomorrow.
So that's great. So
yep.
We're working to update our systems and take those applications as fast as we can.
Well, thank you for that. Okay, Claude, thank you. And next question?
Our next question is from Mabel in Fort Washington. Mabel, you're on with Congressman Hoyer.
Good afternoon, Congressman. My question is, I'm a senior citizen in my 70s, and I have quarantined myself since March the 15th. And I've only had to go out once, and that was to get food. My question is, if I so happen to come down with the virus and I don't have a primary care doctor per se because I am a military dependent, and so when you go, you see any doctor that's available. I wanted to know if I needed to be tested, what would I do or how would I go about that if I feel that I've come down with the symptoms?
Well, I'm going to yield to Dr. Sharfstein to give an answer to that. But let me tell you, generally speaking, even though you don't have a personal visit, I don't know whether you go to Andrews Air Force Base or Malcolm Grow Hospital. I don't know where you get your medical treatment. But even if you have a general practice where you don't have a particular physician, if you talk to that physician or one of the physicians in their practice, and you give them I've got a fever, I've been running a fever of 102, 103, and I've got chills and flu-like symptoms, they will advise you and they will authorize you to get tested. But Dr. Sharfstein, let me yield to you.
I think it's a great question. The first thing to do, though, if you're starting to feel sick, is to call that clinic. Call the clinic that you go to, just like Congressman Hoyer says. They may tell you you don't need a test. You're on your own. It's safer for you just to stay where you are and be in contact with them by phone. Or they may tell you, we'd like to do a test. But they'll talk it over with you. If they tell you to do a test, they'll give you the instructions on what to do. Some people who are sick but not that sick may not need a test if they're isolating themselves at home, just like you're doing. And let me just say, you're doing exactly the right thing to protect yourself and to protect others. And you might be able even to get somebody to go get groceries and bring them to you. That would be even better. But you're doing exactly the right thing. It's very unlikely you're going to get sick if you're by yourself like that at home. And if you do get sick, you should call the clinic to talk it over. Just one last thing. I think it's really important, if you're doing the right thing and living by yourself like that you make the extra effort, and other people that you know make an extra effort to connect to you by phone or by other means like a video chat. I think it's important for all of us to try to stay connected. One of the most difficult things about the virus is that it forces people to be on their own. And, human beings, we like to get on, we like to talk and interact with each other. And we have to fight what the virus is doing in part by being there for each other, even if we can't be there physically.
Mabel, I think that's great advice. I don't know whether you have grandchildren. I have grandchildren, and I have some great-grandchildren. And I was on the telephone for about half an hour with my granddaughter yesterday. And, we can keep it. The good news is we're living in an era where we have great communication devices, and we can keep in touch electronically, virtual ways. And I think that's good advice for your mental health and also for your safety. So people, I have my two daughters, I have three daughters, but two of my daughters have a conference call every day with me to make sure Dad's okay. So Dr. Sharfstein's advice is very good advice. Okay, next question.
Again, if you have a question for Congressman Hoyer or any of our guests, please press *3 now. Our next question is from Melissa. Melissa, you're on with Congressman Hoyer.
Hello. Thank you for taking my call. My first question is, I have a daughter who's pregnant and she's due in July, and my concern is being around the newborn, not knowing whether or not we have the COVID. Is there any way or any exceptions being made for that type of situation where people can get tested before they're around the newborn?
Dr. Sharfstein?
Well, in general, if you have no symptoms and you're not sick, it's pretty low priority for testing, given that there are so many sick people who may need testing just for their health right now. But in general, I totally understand why everybody wants to pick up and hug a newborn. I'm a pediatrician and a dad, and I can understand how hard that can be. So, I think it partly depends. It's something probably to talk over with your doctor. For example, if you are in a job where you might be exposed, like if you work in the healthcare system, it might be a better idea, not to do it for now, as hard as that is, because, you might be exposed, and it can be very hard. Even one test isn't enough, because what about the next day? What about the next day? You really would have to decide. On the other hand, if you're sheltering in place, you're basically staying at home. If you've been at home by yourself for 14 days, your risk is incredibly low for having this, and your doctor may feel perfectly fine with your picking up the baby.
But I think the best advice there was talk to your daughter's doctor and get direct advice. But I think Dr. Sharfstein is correct. Probably err on the safe side. Thanks, Melissa, and good luck to your new grandchild coming in July. I understand. Next question.
Our next question is from Sheila in Prince George's County. Sheila, you're on with Congressman Hoyer.
Hi. Thank you all for putting this conference together, for everyone involved, and all of you take care, and our prayers go out to all the first responders. My question is concerning the nursing home. I wanted to know, I have relatives that work in a nursing home, and, of course, I have family members that's in a nursing home. And my question is, the nursing home employees don't have masks or gloves, and so what is being done to safeguard them? They are also on the front line, and we don't know if any of them may be asymptomatic and they could give it to an elderly person that's in the nursing home. So what's being done to make sure all that is taken care of, and what's the rules and regulations on that?
Dr. Sharfstein, we keep picking on you.
No problem.
Dr. Sharfstein, by the way, was the Commissioner of Health for Baltimore City at one point in his career, and also a Deputy Commissioner at the U.S. FDA, the Food and Drug Administration, so a lot of experience. Doctor?
Sure. So the issue of nursing homes is very serious because there have been a number of outbreaks in nursing homes, and of course, so many people who live there are very vulnerable to serious infection. So it's a very, very serious situation. There are a number of rules and recommendations for nursing homes. You can actually, download them yourself at the CDC's website, but I'll give you some examples. One of them is they have to really limit visitors. The other is they have to make sure that their employees are not sick. Those are two. The third is they want to minimize the contact between people, so there's no more bingo and there's no, everyone gets together in the TV room for a party, unfortunately. Then there are other things that nursing homes are doing, which include assigning staff to particular floors, so the staff don't work in more than one floor, and also having people eat in their room and away from other people. So they're trying to minimize the actual contact with people as much as possible. Having said all that, the concern that you had is a serious concern, and it's one of the reasons why we're also worried about the general lack of protective equipment in the country for people, because if you say to me, is it possible that somebody who feels perfectly healthy might be carrying the infection and pass it on to someone? That is a possibility, and that's why we're seeing in part so many outbreaks right now. So the nursing homes have to try to do everything that they can, like I mentioned before, and all the other recommendations. They also have to be ready to spot one infection. If they spot it, to immediately respond and figure out where it came from. And things like testing really needs to be done to find where it might have come from and make sure that that is not posing a continued risk. So we have been able to reduce the risk of infection in nursing homes, but we have not been able to eliminate it. And part of that has to do with the fact that many nursing homes do not have sufficient protective gear at the moment, and remedying that situation is very important.
Sheila, let me say something about the protection that was Dr. Sharfstein just mentioned, the personal protection equipment, gowns, gloves, face masks, that not only keep the personnel in the nursing home safe, but also keep the residents of the nursing home safe. And we are doing everything possible. And if you saw the press conference this morning, we're making every effort to get as many face masks, gloves, aprons, all sorts of gear available, ventilators, so that we will have the protection for our frontline workers, which are the people who work in the doctors, the nurses, the attendants, other personnel in the hospitals and health providers will have the protections for themselves, but also will be that protecting the patients as well. And we're making every effort to either get existing or have those made in very, very large quantities, millions of units, so that there will be no provider in the country ultimately, and certainly in Maryland. The governor is working very hard. We're working very hard through the federal level to make sure we have the personal protection equipment that people need, who are showing so much courage trying to keep their fellow citizens healthy and safe. Next question. Oh, by the way, before we go to the next question, I have a website, and if you got a pencil, pretty simple, but you got a pencil or pen, write this down. It's my website, my congressional website. It has a lot of information that we've gotten from relevant agencies, healthcare providers, the SBA, the IRS, other agencies that will be interfacing with the public. And I think you'll find it very helpful, and you can probably find answers to almost all your questions. And that is at Hoyer, Hoyer, obviously, .house, just like a house, .gov. If you go to that, I think and we have a specific at the top, you'll see coronavirus site, and go to that site, and then I think you can answer a lot of questions. If we don't get them answered on the phone tonight, you can get them there. Okay, next question.
Thank you, Congressman Hoyer. Again, if you have a question to ask Congressman Hoyer or any of our guests, please press *3 now. Our next question is from Sandy in La Plata. Sandy, you're on with Congressman Hoyer.
Okay, thank you. Good evening, everyone. Thank you, Congressman Hoyer. We serve a large homeless population in Southern Maryland, and I heard about the personal protection supplies, and I hope that we're not forgetting this population, that we're serving these folks that are frontline as well. Unfortunately, we had to lay off 21 people during this time, and I wanted to know if we're able to bring any of those folks back. What is the time frame for any funding that would be available to help us with payroll for those folks? And is there a long wait time? Do we bring them on, and then is there this application process and a wait time before that we're able to pay them? And I'm looking at cash flow.
Sandy, obviously that's a very practical problem. Let me yield to who wants to take that question, because obviously the question says, how soon can I get a loan so when I hire people back, even though I'm going to be reimbursed for that loan, but I need to get that loan as quickly as possible so I can get them back working.
This is Steve Umberger out of Baltimore, the district director for SBA, and I think I'll take that one. The Paycheck Protection Program, and we just had the regulations right before this call posted. Guidance should be out very, very soon. This program is delivered through the banks in the state. Well, throughout the country, but in our state. Nearly every commercial lender, there's a number of non-bank lenders, certified development, just about every financial-based institution in the state of Maryland has authority to do this Paycheck Protection Program loan. Excuse me. So the process will be expedited, although it's backed by SBA, excuse me, and the federal government 100%, which gives those lenders very, very large incentive to make these deals. The process time would be much like a normal commercial loan. I can't say exactly how quickly they can get that money out there, but it will be expedited, and once we get the go-ahead, It could be as soon as tomorrow. And even before that, you can visit your lender that you do business with now to talk about the program.
Sandy, I'm going to have somebody in my office contact you. We've got your telephone number. We'll get in touch with you so that we can help facilitate getting that done. Because not only is your work extraordinarily important, and I know of your work, as you know, but it's also very important to your employees that we see if we can get them back on their feet. Okay, we'll be in touch with you, Sandy. We'll call tomorrow. Next question.
Our next question is from Vanessa in Upper Marlboro. Vanessa, you're on with Congressman Hoyer.
Good evening, and thanks for this forum, and thanks for your leadership. I am a small business entrepreneur. I provide mental health services, and my question is regarding a current small business loan that I have through a bank. And the question is, are there any provisions being made for deferring any loans that are made with small business owners at this time?
Stephen, you want to take that, or Antonio?
Yeah, sure. It's Antonio. I can take this one. So Vanessa, the question you asked is a great one. There's a lot of emphasis right now placed on our new loan programs, but there are people like yourself who have already had loans, maybe for a year or longer, and you're still making payments on those. You can go to your bank or your lender and let them know that you want to get a deferment on your loan, and they'll be able to work with you to do so. One of the really, really significant things that has happened, and I know it was in part because of some of the urging that the Maryland delegation has done, all of the federal banking and financial institution regulatory agencies in unison sent out a communication to the financial sector, the banks and such, saying, we need your help. We need you to be flexible in making sure that anybody who needs relief from a payment can get it. And so they've encouraged them to not only make these loan modifications and give you the ability to defer your payments for a period of months, but they've also told those banks that they won't downgrade their loans for doing so, which is normally what happens if something like that happens when the examiners come around. So there's a strong emphasis on doing that for any bank. If you're with the SBA on one of our loans, we're doing the same thing too. If you've got, by chance, an existing SBA disaster loan, we're saying no payments for throughout the rest of the year. Likewise, our disaster loans can be deferred up to 6 months. Our regular SBA loans can be deferred up to 6 months if you already have payments that you're making with an SBA loan for anybody else that has that situation. So there's really just a tremendous commitment by all parties at the federal, state, local level, and really an unprecedented way to make relief available, either through existing maneuvers with respect to something like deferring your payment, or through some of the new loan programs that we have. And we can certainly answer questions on those too.
Vanessa, there's a realization, Vanessa, that people like yourself and other small businesses and individuals are in great distress through no fault of their own. The coronavirus has attacked worldwide and disrupted people's lives worldwide. And what we have done is try to make sure that disruption is as minimal as possible, and that both the public sector and private sector show great flexibility in trying to make sure that people stay on their feet, get on their feet, and when this coronavirus threat diminishes or passes, that we will be able to put people back to work, and to the extent that we can keep them on a payroll right now and keep the business stable right now, we will have a greater ability to do just that. So I think you'll find the financial institutions will work with you. And if you need help, give our office a call. I'm going to give some numbers a little later on. Okay, next question.
Our next question is from Greg in Bowie. Greg, you're on with Congressman Hoyer.
Hi. I'm trying to find out, as a senior citizen who receives Social Security, is it true that they'll automatically just be sending me the $1,200?
That's true. That's true. Now, you understand that we have a couple of 100 million people we're talking about in the country. That's why this bill is so expensive, but absolutely essential to keep everybody on their feet, and frankly, to put money into the economy. And obviously, there's going to be a lot of pent-up demand after people can get out, but immediately people need assistance. As you saw, there was the unemployment applications this past week were at 6 million people. So the answer to your question is yes, Greg, you'll be getting a check. I don't know what your income is, but assuming you're $75,000 and less, you're going to be getting a check for $1,200. And if you have a wife who's also less, and so the two of you make less than $150,000, you're going to be getting $2,400. So the answer is yes. Now, I can't guarantee how quickly it's going to be, but it will be as quickly as we can make it happen. Okay, next question.
Our next question is from John in Greenbelt. John, you're on with Congressman Hoyer.
Hello, Congressman, ladies and gentlemen.
Hi, how are you?
Thank you for taking my call.
You bet.
You my question relates to the new policy change that came out with the public wearing masks now. We all know our hospitals, nurses, doctors don't have enough of them. And they're not getting them in a timely fashion if anybody's watching the news and sees that. How do they expect the public to get all these masks? I know they said, wear a bandana, wear this, wear that, but, a lot of people are not going to do that, and they're going to want, they're going to be bidding to try and get masks. Is there any solution to that?
There is a solution, and I can't tell you exactly how successful it's going to be, but I do know that at the federal level as well as the state level, the governors, the private sector health and public sector health organizations are calling around to find items that they need, gloves, masks, aprons, gowns, I guess is the proper term. When we're trying to get, for instance, masks, we made a specific provision in there so that the principal producer at that point in time of the most effective mask, 3M, could ramp up very, very substantially. We put money in for ramping up production. And on the television today, General Motor and Ford are both trying to retool so they can produce ventilators, very critically important for the most critically ill. So the solution is, which we are pursuing, is to ramp up production very, very smartly. And frankly, a friend of mine is making masks. She's a seamstress. She likes to sew, and she's making masks, and she's going to give them to nursing homes and others. I don't know how many she's going to be able to make, but I think people are doing that all over the country. But manufacturers are also ramping up very rapidly, and hopefully we will have in the foreseeable future, now whether that's 2 weeks or 3 weeks, sufficient supplies so that we will not have shortages. That may be optimistic, but I know that the administration is working, and we are working very hard to urge people. For instance, in St. Mary's County, I have a business in St. Mary's County that's making sanitizer and giving it to public institutions and the county government. at no charge. They're donating those, but they had the capacity in their business to make it, and they're doing so. So the answer is we all have to work together, but particularly the manufacturers who are perhaps producing something that if they turned it to masks or rubber gloves or gowns, that they could get that they could get those done in big numbers very quickly, and that's what we need to do, and that's what we're urging the administration and the private sector to do. I talked to Bill Ford, the president of Ford Motor Company, about 4 days ago, and he said that they were looking at using their manufacturing capacity to produce ventilators. GM is doing the same. So let's hope that we get to a place very quickly where we don't have any certainly medical personnel who don't have the supplies they need to protect themselves and serve the public, but others as well. Anybody want to comment on that, Dr. Sharfstein? Do you want to comment on that?
I just say that that it is very important to know the difference between the medical grade masks and the kind of homemade or manufactured masks. And the medical grade masks, both the N95 and the surgical masks, really should be for healthcare workers. That's really what people need if they're going to be in contact with sick people, particularly. Now, other people can wear other kinds of things, and it could be a mask, it could be a scarf, it could be a bandana. I think that the recommendation that's coming out tonight is for people to improvise in public, but to the extent, going back to the earlier question, that there aren't medical grade masks for nursing homes, then they'll also need to improvise for the time being. But our hope is that first, so the fear that people might use medical masks and take them away, we've got to just constantly be saying that's not a good thing. That for the public and outside, it should be non-medical grade things. And I think when businesses are making masks out of fabric really quickly, those are good for the public to be wearing if they're interested, but they're not for the hospital. We got to save the real ones for the hospital.
I agree with that 100%. We really do it now and later. Thank the nurses and the doctors and the attendants and the administrative personnel at these hospitals and medical facilities who are obviously very, very stressed because of the risks they're under, and they see their colleagues getting sick. So we need to thank them. They are real heroes, as well as our police and fire and our emergency medical response teams who are showing real courage. Frankly, I go to the grocery store. I've been to the grocery store twice in the last 15 days. And I go in there and I stay away from people, but boy, I will tell you, I thank the folks who are working in that grocery store for keeping me fed. Some of them are wearing masks and some are not. But in any event, we need to thank all of these personnel who are really making a difference as we fight this scourge. Okay, next question.
Our next question is from Maurice in Prince George's County. Maurice, you're on with Congressman Hoyer.
How you doing, Congressman, and to the other gentleman that's on the conference call? My concern is, one is my brother, he has an issue where he was laid off in D.C., where he's getting partial of his check. He wanted to know under the stimulus program where he get the difference to make up for the $600. For the week.
Whatever he's getting, he's going to get an additional $600. So now, that's the general answer, but let me ask one of the small business folks to address that. Or Michael, perhaps you want to address it.
Yeah, sorry, sure. This is Michael Harrison, Department of Labor. Thank you, and thank you, Maurice. I believe you said wages were earned in D.C. I'm not sure, but first you have to file for unemployment benefits where you worked, not where you lived. And when you file, you will be eligible for the $600 a week for 4 months. And when you apply, it will be backdated to the date of separation. And you will also be eligible for state benefits for the 39 weeks or as long as you were unemployed.
It's a very generous benefit, Maurice. And the reason it is, we want to have people have money in their pockets that they would not be falling through the slats through no fault of their own. We understand, and the Governor Hogan understands, the President understands, and members of Congress understand that we are asking people to, in effect, put their lives on hold in some respects, and we're trying to give them some sort of financial help while they're doing that. And not only do we want to give individuals help, but obviously we want to give businesses help as well. And I'm talking about large, medium, and small. We're talking about a lot of small businesses now, but there's a substantial money in there for large businesses who hire, of course, a lot of people, thousands of people. And we want to make sure that those jobs do not go away, that companies don't disappear, which is possible. And so we're giving them financial help to get through this phase so that jobs are available for people when, as I say, a safer environment prevails and we can get out and about and do our work. Okay, next question.
Thank you, Congressman Hoyer. We've actually reached the end of our time together this evening. And before I turn it over to Congressman Hoyer for some closing remarks, I'd like to remind everybody that if we weren't able to get to your question or comment, please remain on the phone, and at the end of the call, you can leave a voicemail. Please leave your name, address, email address, and your message. Congressman Hoyer?
Well, thank you very much, Annalise. I'm sorry that, in these, it's too short a period of time. We can't get enough questions. But first, let me ask, would anybody like to make before I do, a closing comment that might be helpful to everybody, and maybe general comment? We'll start with Dr. Sharfstein.
Sure, I would. Thank you for
the
chance to do this. Can you hear me?
Yeah, I can hear you.
Great. First, I wanted to thank you, Congressman Hoyer, for hosting this. I think it's really, really important to be able to get good information out to people. And then I wanted to thank everyone for dialing in, and just to say that all of us have a responsibility to spread good information about this. That's the way we fight the spread of the virus, letting people know how important it is to stay home, to wash your hands, to do all the things that we're supposed to do. That is every single person on this call, and all the people we all talk to are a part of the solution, and it will make everything easier. Everything that we can do later from an economic point of view, the seeds of that we're planting now by doing the right things from a health point of view. So I just wanted to thank everyone who dialed in.
Anybody else want to make a comment before I close?
Yes, Congressman,
sure,
this is Antonio Doss again with the Small Business Administration. I just wanted to, again, thank you for putting the session on. And I also wanted to let the people here on the call know, particularly those who are small business owners, that there are really just a number of different ways that the SBA is working to provide additional support. We've got direct loans through our economic injury disaster loans, which is a great way to get working capital support in for your business. Through the CARES Act, we've got the Paycheck Protection Program, which is a way that you can get money to keep your payroll going, to keep your people employed. And if you use the money almost entirely for that purpose, then you're going to be able to essentially get your loan forgiven. Both of those loans are at very low cost. And if you're still looking at borrowing money, maybe you're in the midst of purchasing equipment or some sort of business expansion, we're actually covering the cost of your loans through our program that we also got through the CARES Act. So for the first 6 months, SBA is basically making sure that you don't have to worry about making your loan payments, including principal, interest, and fees during that period of time. The scope of things that I've seen us do under these programs, the one with the CARES Act and what we've done really through the authority of our administrator, Jovita Carranza, has been beyond anything I've ever seen us do. So I feel good that the government at the federal, state, and local level is all coming together to do our share to help you as business owners successfully navigate through this period.
Thanks a lot for that comment. Michael, any closing comment?
Yes, thank you. I would refer people to our website, Maryland Labor, and also for the employers out there, one thing I did not get a chance to talk about is the work share program, which is not a grant program, but it is a payroll protection type program where if you have workers whose hours are reduced because of the virus, they are eligible for a work share program, which would be a partial unemployment benefits they could receive while working. If the employer is enrolled in the work share program, employees could receive partial UI to keep them enrolled, keep them on the payroll, keep them on the books. So when we're through this successfully, everybody can get back up to speed quicker. Now, there's information on the work share program on our website. If you just Google Maryland Department of Labor. Thank you.
Okay. Well, thank you, everybody. And Andrew, thank you, and Stephen, and all of you for participating in this town meeting. I think it's been very helpful for people. There were 11,435 people on this call. We only got probably 10 questions. So there are a lot of you. If you haven't gotten answers to your questions, you ought to give us a call. I want to thank our guests and everyone who joined the call. Here in Maryland, officials from both parties, very bipartisan. We're in this together. This is not about politics. This is about the health and welfare of our people and our economy. We're working closely together to ensure that our state is doing everything possible. As I've said, and you've heard Dr. Fauci and Dr. Birx and the president say, flatten the curve to protect all Marylanders and, frankly, all Americans. My office will continue to be a resource for residents, and we will do all we can to keep you up to date. Please visit hoyer.house.gov for resources and information. I think you will find answers to almost all of your questions at that website. If you ever need any assistance with federal agencies, please contact one of my district offices. If you live in Prince George's, Anne Arundel, Calvert County, please call my Greenbelt district office, and I'm going to go slowly on this, 301-474-0119. That's for Prince George's, Calvert, and Anne Arundel counties, 301-474-0119. Now, if you live in Charles or St. Mary's counties, please call my White Plains office at 301-843-1577. 301-843-1577. And also, as I've said a number of times, you can go to my website at hoyer.house.gov. If you develop symptoms and believe that you have been exposed to the coronavirus or interacted with someone with a confirmed case, you should contact, as has been said, Dr. Sharfstein pointed out, your own health care provider right away. If not, just stay vigilant and continue to practice proper hand washing and hygiene while obeying the stay-at-home order. As you know, there are exceptions. You got to go to the grocery store, you got to go to the pharmacy, or some other absolutely essential trip that you have to take. But to the extent that you can possibly do it, stay home. We can get through this and defeat the coronavirus if we work together. My staff and I will continue to work throughout this crisis to help 5th District residents, and very frankly, a broader group than that, as we always have. We're here to serve you, make sure you have all the help you need dealing with federal agencies and getting the most up-to-date information. Again, go to my website on what Congress is doing to protect the American people in Maryland, and that I'm doing to help protect the people in the 5th Congressional District. Thank you very much for joining our call. God bless you, good health, and stay at home. Bye-bye.